Thank you, Will, so much for being here today. I just wanted to start with the opportunity for you to introduce yourself and tell us a little bit about your role in the organisation that you work with.
I'm Will Siero from the Murdoch Children's Research Institute. We're Australia's largest child health research institute based down in Melbourne in the Parkville precinct. And my role is I'm the project manager and stream lead for the GenV 2020 cohort, or Generation Victoria, as some people may have heard about it. And so that means I'm responsible for supporting our field team across 60 hospitals, all the maternity services across Victoria, and we've got about 140 team members across the state, speaking with new families every day.
And you mentioned earlier that it's been about 3 or 4 years that you've been on this journey. I'm curious, just to go back to the beginning of that journey, what were some of the business challenges that you were looking to solve?
GenV is a research study that really tries to take a different approach to child health, development and wellbeing. And what we're doing is, rather than recruiting and having lots of little individual studies to answer individual questions, we're building a platform that's really set and ready to find solutions to health, development and wellbeing challenges that children and families face. And so our real significant challenges were, how do we engage with and speak with and provide every new family of a baby over a 2-year period to take part in GenV, so that we can then follow them for many, many years. So 2 really key challenges were, how do we facilitate an interaction and a recruitment interaction into the study? And then also, how do we keep a long-term relationship with that family, so that then we can pull together data and biological samples to make them available for research.
Thank you, Will, for telling us a little about GenV. I was really keen for you to elaborate on that and just tell us a little bit about the significance of the project, because it is quite a large and significant piece of work that you've embarked on.
GenV is, or has the opportunity to be, one of the largest, if not the largest, child health, development and wellbeing cohort study on the planet, which I think is really exciting, really amazing. What we're seeing in adulthood, and especially late adulthood, is these mega studies in the UK and the Netherlands, the US, that are really transforming the way that we address policy and practice questions, prevention, treatment, early intervention. We're not seeing that in children, and also in young adults and that parenthood and family space. And so GenV is really seeking solutions to better prediction, prevention, treatment and services for the Victorian children and families, but also children and families in Australia and all around the world. And so I suppose it really does represent something pretty unique, pretty impactful potentially, and is a resource that hopefully will be used by many policymakers, researchers and service providers for decades to come.
It certainly sounds like a huge piece of work, and I'm sure technology has a pretty strong role to play in that piece of work. Just over the past couple of years, going through the pandemic as we are, I'm just curious, have you seen any significant changes or impact on the challenges?
Most definitely. So I think there's almost 2 parts to that. The first part is obviously the huge impact that it's had on our societies, on pregnant women and families during pregnancy, but also young children when they're born and in their early development. So, mums having to measure their own stomachs during pregnancy because they can't get face-to-face for care because of COVID. Babies not seeing the maternal child health nurses in early life. And what we see is the likely impacts of that around health, development and wellbeing. So number 1, I suppose it makes the need to understand what life looks like for this generation even more important. Thinking about what we've tried to do during this process, we planned and we'd been thinking and talking about GenV for about 6 or 7 years and really got going about 3 or 4 years ago, was how do we see people when you can't see them, where you can't be in hospital, where they're going home early. And so that really moved us to having a much more mixed approach to how we do things. So face-to-face where we could, where it was safe and appropriate, but a lot more sort of virtual telehealth and technology-driven recruitment engagement with our families. And so, definitely technology to enable that was a huge part.
When we think about the technology, with Salesforce in particular, what role has Salesforce played in helping to overcome some of those challenges?
So we chose Salesforce as a solution after going out to market before the pandemic, before we thought of that this was going to be a problem or a challenge for us, as our model and our system to manage our participant interactions and that relationship going forward. I suppose we're pretty happy that we did choose a solution that would enable a switch from driving a face-to-face interaction to being able to interact with people both over the phone, but also SMS and email to enable them to interact with our recruitment platforms and that sort of thing. So it really enabled us to make that switch, I think, in a way, because of the breadth of what we could do with the system.
It's been particularly interesting seeing many organizations see some form of silver lining in the pandemic, if you can see it that way, and really accelerate the ability to deploy things like telehealth, for example. I know as a telehealth customer myself, it's something that I don't want to go away. So hopefully we can see some silver linings there. I'm curious, what advice would you give to other organizations who are perhaps embarking on this journey now?
It's so funny because I think we always assumed that you plan out, and we did have a plan. We thought we knew what the next couple of years was going to look like, and I suppose it's pretty safe to say they didn't happen. I think the big thing for us was there was no silver bullets. It was really around putting our people first and getting the right people in the virtual room as much as possible to really sort of incrementally face into the challenges. There was just too many things to deal with, every single thing all at once and in advance. We really had to move quickly. And so I think for us, it was, for instance, when it came to how do we use Salesforce differently in our, how do we interact with our participants differently, it was getting, our recruiters who were out in the hospitals together with the team of developers and BAs who were helping us build out what it needed to look like in this different model. Starting small and really iterating and building on that to get it there quicker, rather than waiting for a gold-plated solution and it would be too late.
And staying on the theme of advice, if you had your time again, is there anything that you would do differently through this project?
I'm sure there's a list longer than I can imagine. I think it would probably have to be really sort of almost doing that more. So taking my own advice in some respects, really, we always knew that we wanted this virtual model. We're working across the whole state of Victoria with regional families where it's not always as easy to see them face to face, especially with hospital transfers and where they get care and where they're born being different places. And so, really we knew we needed this capability, and we probably should have got going on it earlier, and it would have made it a slightly smoother ride for us. So I think it's, building up all of your capabilities that you're going to need, but to the minimum to get going.
Thank you, Will, so much for sharing a little bit more about GenV today. It's been insightful to learn how things have progressed over the last 3 or 4 years, and I wish you the best in the future. Thank you.
Thank you so much.
It's lovely to see you today, Claire. Thank you so much for your time. I just wanted to start today by asking you to share a little background on HammondCare as an organisation and your role with HammondCare.
My name is Claire McCarthy, and I'm the head of the foundation for HammondCare. HammondCare is coming up to its 90th year, providing aged care and dementia support across the east of Australia. Our stretch goes from South Australia over to Sydney and north suburbs. We provide aged care through dementia. That's residential care, home care, and we also have palliative care provision across 3 sites in Sydney. That's Greenwich, Nuringa and Braeside hospitals.
And can you tell me a little bit about your role with HammondCare?
I've been with HammondCare now for coming up to 2 years. I have an extensive background working in fundraising through paediatric palliative care and health. So the role for the foundation, our purpose and our reason to be in existence at all, is the foundation was set up 10 years ago, and that was to provide a vehicle for us to bring in philanthropy and fundraising to extend the services and to ensure that we can, anything that is not government supported, the foundation steps in. So we have also, one of our huge projects that we have is the Dreams project, and that is to facilitate therapeutic support for people who are in palliative care. And what that looks like is the question around, for a patient in palliative care, is what would you do if you could? That is a question that is front of mind for a lot of patients who are receiving palliative care and also for their families. We are offering the Dreams Project, so there is no cost at all to patients and families. And for patients who are in receiving palliative care, it's that quality of time that they can spend with their families, or indeed if there is a dream that they have that they would like to fulfill at end of life, that's where the Dreams Project steps in. And it is very much part of the therapeutic benefits of the palliative care on offer at HammondCare.
Finding hope is always difficult when you're in life-limiting disease.
When people are diagnosed with a life-limiting illness, while we can't cure people, in a sense we can heal people. We can heal people to know that they matter.
The Dreams Project is more than just making a wish or having an experience.
Because mostly people's dreams or wishes are something to do with the significant people in their life.
Dreams can be really varied. For some people, it might be a dinner with family and friends, or a photo shoot to have a family portrait that not only is a nice moment for them, but provides family with long-lasting memories.
Memories are very important. Yeah.
Because people still matter. They don't cease to be people, and they don't cease to matter. They do continue to matter right to the last moment of their life.
Wonderful, thank you. It's such an important service that's being provided to those who are really in need. In terms of the business challenges that you were looking at when you embarked on this project, can you tell me a little bit about that?
The Dreams Project is very organic. It's very much on the spot, so it's hard to plan for. And what we have relied heavily on in just recently is with Salesforce, how do we bring in the technology and the IT infrastructure that will take the burden of the social workers and the volunteers who assist with the rollout of the program. So what the Salesforce program has allowed us to do is to use technology. It's lifting any of the stress off the allied health team to be able to do what they should be doing, and that is to be with patients and to roll out the dream. So we can capture information in the cloud in a very safe environment that is going, if we have a similar dream, we can go, you know what, we know who we contacted there. So it's also keeping a database record for us that's easily accessible. And of course, Salesforce is such an easy tool to use. The allied health team can access it quickly and easily. We help from the foundation's perspective to run the administration of it. They can do what they need to do, and that is that person-centered care.
It's wonderful to hear that the technology is providing those efficiencies and really giving your client-facing staff as much client-facing time as possible, which is really what they're there to do.
Yeah.
So it's no secret we've been through a pandemic over the past 2 years, which continues. Did the pandemic impact your challenges in any particular ways?
It did. Andrew, the biggest challenge for us is first and foremost, it's patient safety and that of their families. With the dreams, we were restricted in what we could do, but I'll tell you how we, the good old pivot word. For example, just before Christmas, we had a family, a person who was in palliative care in a regional area, and we were able to facilitate transporting a family member to get home to have those last days with the family. So public transport is still running, and we were able to get transport organised. Where it has been impacted is something like, say, if a family wanted to do a trip to Dreamworld. Obviously, we weren't able to get into Queensland from New South Wales. So what we've done is just been able to work within the parameters, right? What can we do? So for another patient whose dying wish was that she could have a dinner with her husband, we were able to arrange that for her in a restaurant nearby that was open, that was COVID safe. So it was very much working with what is possible. I think it's easy to go down the road of, well, it's all too hard, but the palliative care team and the allied health team at HammondCare are all about what's possible and what can we do. We had another lovely interaction just between those two latest lockdowns. We had a patient at Greenwich Hospital whose wish was to meet his West Tigers team that won the grand final, I think in 2005, when there was 3 members he hadn't met. So we were able to facilitate that meeting, and in a COVID safe environment, they were able to meet. But the beautiful outcome of that was that when he was in his last days, one of the team members called to find out how he was. The social worker was able to say, the players on the line wants to know how you are. And we know that that had a very fulfilling part in that end of life transition for the patient. So we work with what we can.
In terms of the, I guess, the use of Salesforce within with the pandemic over the last couple of years, are there elements of the technology that have really helped in overcoming those challenges of providing some of this experience to clients or to the staff in general?
It's hugely important for us. So we have a database of donors and people who generously contribute to our programs across HammondCare. And Salesforce for us is there's so much information coming in constantly from donors, being able to capture that. And the big thing, obviously, Andrew, when you're in such a high touch relationship based environment is the data is only as good as what goes in. And fortunately, the fundraising team at HammondCare are all very much person-centered when we talk about, and it's also capturing data that's not going to get lost because, there's so much information coming in. So we rely very heavily on what we put in, but also being able to run the reports. It's the ease of access, and particularly sensitivities. Across HammondCare, Salesforce has multiple uses, so ours is very different from others, and we're very conscious of if we didn't have something like Salesforce to be able to capture that information. When you think of life without it.
So thank you for sharing that. You've been on this journey with HammondCare for a couple of years yourself now, and I know HammondCare's been on that journey with Salesforce for a while longer. What advice would you give to other organizations in this sector who are looking at embarking on that journey themselves to help drive success?
To me, Salesforce is like having a Ferrari.
Mm-hmm.
You don't drive it in first gear. You got to use all the gears and you got to drive it, and it loves being driven in fifth, at maximum speed. So I would say anybody who's coming into an environment where they're not familiar with Salesforce is get to know it, get to know the mechanics, and get to know how you can drive it to its maximum, because that's when it works so well. I think there are features there's so much that really get to know what features it is that you need to be using. And everything you put in is going to pay dividends later on, because it's amazing what we forget. So that would be my thing. See it like it's the Ferrari and drive it, because that's what's going to keep the well-oiled machine going.
Claire, I just wanted to say thank you so much for sharing your story today, the story of HammondCare, and for the amazing work that you do with HammondCare and HammondCare does in the community. It's greatly appreciated. And again, thank you for sharing your story.
It's a privilege. Thank you, Andrew.
Thank you so much for joining us here today, Gabbie. I just wanted to ask you to start by telling us a little bit about Montefiore.
Yeah, absolutely, with pleasure. So I'm Gabbie, Budai. I'm the General Manager for Client Experience and Marketing here. We're a 135-year-old aged care facility, which has several branches to our portfolio. So we have 4 residential care facilities, one in Hunters Hill, Wallara, Randwick, and Maroubra Shores facility, which is not branded Montefiore, but it's the Maroubra Shores aged care facility. We also have a home care or support and community business called Help at Home by Montefiore, whose offices are based down in Double Bay, as well as our newest offering, which is the retirement village here based at Randwick in King Street, which are 79 luxury retirement village apartments, and we're growing that community in real time as we speak. So that's a really exciting initiative for us. So we offer the full continuum of care, which we're really proud to offer to the community and broader.
Wonderful, thank you. And GM of Client Experience and Marketing, can you tell me a little bit more about what that means on a day-to-day basis?
My portfolio really looks after the acquisition points for the master brand of Montefiore. So we look after all of our, point of sale and reference material for our inquiry and acquisition process. So that's for both Help at Home and Montefiore, Help at Home by Montefiore, as well as our residential care facilities. So the admissions team reports into this function, and the occupancy obviously is a large KPI around that team. But most importantly, the client experience and how our residents or consumers in the sector, as they're known, feel about the process of coming into Montefiore, what that looks like, what that feels like, and then the extended client experience that we obviously service them through each stage of their stay with Montefiore, and that applies to all our businesses. So the admissions team, is the start of that client experience. So it's really looking at the collateral and the processes and workflow that ensures consumers feel like their hands are really held. Aged care is a challenging space to enter as a consumer or resident, and it's our job to make that process as seamless and logical as possible, and make that a really enjoyable part of their process, that they really feel welcome to a family. It's a big step, aged care, and making those decisions around that. And often people are stressed, and it's often maybe a critical decision, a timely one, and so it's enabling them to enjoy that process and have it not be a burden for them. We also have the sales for the retirement village that comes through this function, and a very different tone, a very different message, a very different client experience, a very different product. So that's 79 luxury high-end apartments here in Randwick that we're growing and developing that community space. So that's one function that comes within the portfolio. And of course, it's the Help at Home acquisition of leads and client acquisition for supported home. So it's a wonderfully varied portfolio, but really sales and then marketing, which go hand in hand. So it's how we talk to our consumers, what type of communications, what type of channels we're using, and how to leverage and collaborate internally within our brands to ensure we offer consumers that full client experience, so that we start often with them at home. They may come via independent living and ultimately may end up in residential care. So it's looking at the whole consumer, their history, their very long life history, and how that impacts their journey with Montefiore.
You've been on this journey with Salesforce and DataColada for a little while now. Sort of going back a little earlier in the journey, what were some of the business challenges that you were trying to solve as you went down this path?
Montefiore, like many aged care providers, they work off very manual systems a lot of the time. There's a lot of stakeholders involved in that facilitation of the business. And so really the challenges we were facing in the business was that transparent, real-time source of truth for the whole business. Particularly though in admissions, we were very much managing, we've got about 700 beds across 4 facilities. So it was very much a manual process that from a time efficiency, from paperwork and paper trail, we really wanted to make that much more automated and have some more synchronicity with the rest of the business.
And we've all heard a lot about the impacts that COVID and the pandemic over the last couple of years have had on the sector more broadly. But I'm curious about some of the impacts that this may have had in the context of those challenges that you just mentioned, and whether the pandemic has made you rethink any of those challenges or how you would overcome them differently.
I think it was a coincidental timing. I think it's been really a positive reinforcement of the need for the business to move through these changes. I think COVID, of all the sectors, healthcare, aged care, has had a tremendously difficult and challenging couple of years, and we're very much in it at the moment with Omicron. So I think that it was a really timely coincidence that we started the process just sort of at the beginning of this changing world, and so we suddenly had staff remotely working, staff working from different sites, so we could cohort and separate. And it seems obvious, but actually having a system that allows us all to work in real time off-site, the promise of that is really exciting. So that definitely, I guess, COVID has definitely encouraged and reinforced the need from a remote working space. I think as well, emergency and critical communications are now more relevant than ever for organisations. So in the communications piece, we would do 2 to 4 pieces often a day to different areas of the facility, to different parts of the business. And so having that one source of truth in real time with occupancy and making sure we're communicating with the right people, the right points of contact at the right time in any given time is critical, because those communications are essential. They're the lifeline of aged care facilities at the moment. So ensuring we get them out timely and correctly, we're hoping very much Salesforce and Pardot will be the solution. That sort of brings all the clinical and the marketing together.
It's been interesting speaking with clients over the past couple of years as well, and we do hear that the journey and the stage of the journey that they have been on, particularly going back 18, 24 months, has really helped to provide that extra level of resilience, help them be able to pivot, have people working from home or working remotely. So it's great to hear that you've shared in some of that experience too. For organizations who are perhaps not quite at that stage yet, or just thinking about digital transformation or embarking on a similar journey, is there some advice that you would provide to an organization that was at that stage in the journey?
Doing your internal stakeholder management is really critical. Having that hero, the one person who champions that across the business, working as part of an organisation where there's a great deal of infrastructure. I think the most important thing about any systems implementation is that you have the right people on board and around the table initially. I think the hardest part is selling it to your business. It's actually not converting your staff once it's on board. And so I think that would be my initial piece of advice, is to really look at who is instrumental in benefiting from the changes that the system are likely to bring, and getting them to rally and really come as a cohesive solution for the business, rather than it being about one area needing one solution. So I think that's probably one key piece of advice. And I think the learnings around COVID and the need for communications it's really worth considering when you're starting to look at your systems, and not just what a system is going to do for efficiency and how it's going to capture your data and track your data, but in terms of allocating tasks and having your workforce who are working remotely seamlessly working to deadlines and timeframes. I imagine it's going to be much easier with something like Salesforce, where we can allocate those tasks and really track performance and workflow. And the same with communications. I think considering your needs for communication in the business and what data and I guess reference and historical information you're going to need to rely on to plan and market those decisions. I think that you're really looking at your communications plan and how that syncs with Salesforce or the products you're looking at. Again, and having all those stakeholders buy in is a really important factor.
Thank you so much, Gabbie, for taking your time out of your busy day to join us and share some of your insights. I've really appreciated the conversation, and I wish you a great day.
Thank you. You too. Thanks, Andrew.
Good morning. DataColada has partnered with Montefiore Residential Care to digitise their admissions process. Today, I'm going to give you a short demonstration of this work. Fred Hoffman has his mother living with him at home, but he's worried about her and feels that she needs more care than he can provide. Eva Hoffman has recently had a bad fall and she needs care, but Fred will be handling everything. Fortunately, Jo is an admissions liaison with Montefiore, and her job is to make a complicated and scary process easy. Jo is skilled at talking with clients and not sounding like she's entering data into Salesforce. Taking inquiries is the first stage of a process that might take several weeks to complete, or even months, and it's important to keep careful track of all the interactions with Fred and other inquiries so she can guide them through the multiple steps in the process. Jo takes a call from Fred and records Fred's and Eva's details in a simple Salesforce-driven inquiry form, and then goes on to record some key details about Eva. It's difficult to get all the details in the first call, but Jo is able to quickly build the beginnings of a set of related records. The inquiry process seamlessly identifies and uses existing contacts records for Fred and Eva if they exist. Jo can now move on to the application stage by clicking the Create Application button, which creates a link to the application form that she sends in a personalised email to Fred. Fred can complete this form in his own time by adding demographic details and medical information, persons responsible, next of kin. He also uploads his general power of attorney amongst other documents, and this is stored directly in Salesforce as he moves from page to page. Jo's page layout shows each section of the form, and uploaded files are stored in notes and attachments for review by the admissions team. Jo can then choose one of the many room types offered by Montefiore, and all the cost calculations are done for her. Jo then clicks the eCase Resident button to add Eva to the clinical management system using the eCase and Salesforce APIs. All Montefiore rooms are recorded as products in Salesforce with availability status attached. She reserves an available room, and this removes it from the availability list. Jo has now created a web of related and easily accessible records, all related to the admissions opportunity. Salesforce automation handles much of the back-end complexity, and she can move to the final stage, generating a residential care agreement and an invoice. Many residents renew their respite care a few times before moving to permanent residential care, and these transitions are easily managed by Jo by clicking the readmission button on the current opportunity. This clones the current opportunity and allows a new start and end date to be added, and creates a new occupancy record for the currently occupied bed. The readmission opportunities show on Eva's contact record, and all the existing record relationships are preserved so that Jo can keep a history of all of Eva's periods of care. So now Fred is happy to know his mum is in good hands, Eva is a happy resident, and Jo is confident that she has done her job well.